Thank you for joining us for this episode of Inside Town Hall. I'm your host, Madeline Shields. This episode, we're talking about the health of the citizens of Sioux Falls and what the city is doing to help folks maintain their health. And joining me is City Councilor Greg Neitzert, and his guest is Shelby Comus, the Public Health Prevention Coordinator. That's kind of a big title to get that out. Yes. Let's talk a little bit about the health of our citizens and what started this entire project, I guess.
Yeah, so back in 2012, our health department decided that it would be a good idea that we understand what's going on in our community at a more project level. So really getting to know the health status, so whether that be health outcomes and how ill our community is, or our health behaviors, what are those things that we are participating in. And then also the health systems, so Sanford and Avera were doing their own health assessment as well. They are required to do so being a nonprofit status. And so in 2016 then they decided that we would combine together and put forth effort together in doing this health assessment, and we've been doing that ever since.
Councilor Neitzert, what from terms of the City Council, what is the investment in the health of the citizens of Sioux Falls?
Well, it's significant. We do fund the health department. We fund a number of programs that they bring forward to us. It's very important. There's a lot of things that we do in other departments because health really impacts everything. So we want to do what we can to help the citizens of the city of Sioux Falls, and that's where the plan comes in that we've been presented.
Sure, and it's the Community Health Improvement Plan that we're talking about. When did this begin?
So this is a new process this year, a new plan. So as we've gone through the community health assessment and we knew what was going on with the health status of our community, we wanted to do those next steps, really make effort on those areas that we see the most need and see the most need for improvement.
How did the COVID-19 pandemic affect all of this research and the studies?
Yeah, so it affected in multiple ways. In general, there's a lot of public health data that is behind, just in the nature of gathering that data and presenting it. So we were seeing some data that COVID had not impacted yet, some data from back in 2019 that we haven't seen the impact. And then so more local data that we were gathering, that is when we're seeing those COVID-19 impacts, and the data that we are gathering directly from our citizens, those comments that we are gathering from our citizens, where we were seeing COVID kind of impact those responses.
How is this data being collected? Is it a survey, an email, snail mail? How do people find out about this?
Yeah, I think that's something that Shelby can probably answer a little bit better.
Yeah, so it's a multi-tiered process how we do this, and that's in combination with our health system partners. So we do some direct surveys with our population, and Sanford leads that as far as sending out surveys to those citizens as a randomized process. And then Avera conducts focus group interviews, so gathering key community members, organizations together to just sit and talk about the health issues. And then on the back end, we're also doing data collection, data that we get from a national level, from CDC that they are gathering. They do some regular surveys called, one we call BRFIS, or the Behavioral Risk Factor Surveillance System, which is self-reported behaviors. That's an example of one survey we use a lot in this data collection, as well as state data that they're gathering data on infectious disease and other health status of our whole state, including our population here in the city of Sioux Falls. And then we also get data from our fellow city departments, so police, fire, we're getting some of their data as well. So very wide variety of data we get.
And regarding delays, census data, that's impacted us.
Sure.
There's been delays in census data, and that's impacted us in the city in multiple different departments where we needed census data, and I'm sure that probably has effects on discovering what the health of our community is, the demographics. Absolutely. And so that's been an issue for our civic analytics, is delays in getting that data from 2020.
Okay. Well, in January of 2022, the community partners and the stakeholders came up with 5 priority areas. Can you talk a little bit about those?
Yeah, so 5 priority areas were identified. One was active living, the next was healthy eating, the third was mental health and substance abuse, The fourth was to improve oral health through the reduction of dental diseases. And the fifth was preventative care. And I think they're all very big issues that would be great to talk about.
Okay, well, let's start off with the healthy eating, one of the priority areas. What is, from some of this data that I was reading, 40% of adults report that they are not consuming fruits and vegetables. I guess it doesn't really surprise me. We're kind of a meat and potatoes kind of place, and I don't think potatoes are really considered a vegetable. It's not like a broccoli. How do we change that, and what are the ramifications of that?
Yeah, so one of the things that we are trying to tackle through this community health improvement plan and the process that we're doing is to increase that access. So to take that barrier out of the way, we want to make sure that our community members have access to those foods, because it's very hard to consume them without having that access. So we want to make sure that first and foremost, that's something that we're trying to tackle, and something we've already hit the ground running on some of those activities. And then also that education piece too as well. If we have access to those foods, do we know how to cook them? Do we have access to the right type of utensils to cook them, to have a can opener to open canned foods, things like that we want to make sure that we have that equity across the board, that people have access, they know how to cook it, and then we tackle those behaviors on actually doing so.
When you're talking about the ability to have access to some of these healthier foods, we know that there are food deserts in Sioux Falls. We know that fruits and vegetables are extremely expensive compared to, ramen or potatoes or starchy, unhealthier foods. How do we help people eat healthier when they are living on extremely low food budget?
Yeah, one of the things that we've already done here at the city level is we released a grant, the Eat Well Sioux Falls grant. It was a $400,000 grant still available to apply for, but essentially to put that out to the city, to our community members, our businesses, to come up with an idea, whether it's just another grocery store or something innovative and new to bring to the area, to go into those areas that are food access priority areas that we've identified as low access, to take away that barrier of going to the grocery store and bringing those fresh fruits, those fresh produce to the area, because we know that without that access to those fresh foods, they might go to the nearest convenience store and have those shelf-stable foods, but ultimately we want to increase the freshness of that. And part of that innovative process, and something we hope will come out of that, is the cost to that as well, and the benefit of bringing those fruits and vegetables, those fresh produce items and meats at a lower cost. And that might also be an idea that incorporates utilizing already federal benefits such as WIC or SNAP, and accepting those at those locations that we hope to open up in the area.
Okay.
Yeah, and the City Council was happy to approve that $400,000 grant program. Food deserts are defined by the USDA, so we know where those are at. And with the closure of the Hy-Vee a handful of months ago, we have another area in which people are having, access to food issues. And really, when it comes to access, a lot of times we're talking about transportation. There's just a lot of people that just don't have the transportation. They need to go 2 or 3 miles, to the grocery store. And so, in an area such as in my district like mine, for example, Hayward, they might go to a Dollar General, and so all you have is processed foods and things like that. You don't have fresh foods. Talking to grocers, they're looking in terms of where to put a grocery store. They know that there's a need, but it's challenging. It's a challenging industry because the profit margins are very small. And so where to actually put these is something that they have to think about. That's where hopefully with some innovation and with this grant, we might have some small little neighborhood stores that could offer some of those staples, and figure out a business model that could work, because it's a big need.
If folks aren't familiar with what a food desert is, can you talk about what constitutes a food desert?
Essentially, there's multiple tiers, but essentially it's being 1 mile or more in an urban area away from a grocery store. and having certain demographics as a number of low-income demographic or transportation challenged. And there's a second tier that's a half a mile as well. But generally, we measure by about 1 mile from a grocery store from certain census tracts that have challenges in actually getting to a grocery store, whether it be transportation or some other issue.
Sure. And so when you're talking about the closing of the Hy-Vee, that is on the west side of Sioux Falls, and in that neighborhood there's a grocery store on 60th Street North and at 26th and Marion Road. So that's a huge area without access to fresh fruits and vegetables.
Exactly. That is my area, 10th and Kiwanis. There, with that closure, I mean, you're talking about having to go to potentially a Walmart at 60th Street North, which is a very long distance, or going to 41st and 49th and Louise, or going to 26th and Marion. That's a long way for anybody. But if if you have access to transportation issues, that's going to be a major challenge. So we do have things that may happen in the Northwest District up there, but trying to get something where people need it is really a challenge. Close to the Hayward neighborhood, close to the 10th and 10th and Kiwanis, that would be wonderful.
Sure. How do community gardens play in all of this?
Yeah, community gardens are definitely an opportunity to increase access, and I do say there is a lot of interest in community gardens in the area, and so I think that's a wonderful opportunity that we could expand on within the community and in multiple areas, and also expanding not only that community gardens within the community, but also gardening at home and the educational opportunities that we can encourage individuals to do that at home and have that as an opportunity not only to get those healthy foods, but be active in the gardening process. Right. So we welcome that in the city and hope to see more of that in our future.
And what neighbors tell me is it's also the social aspect. The neighborhoods get to know each other. They work together, and so there's a very powerful thing that happens. There's some that happen at schools, such as Hayward, where they have an education program that actually goes with it. There's some private neighborhoods where they just do it on a parcel that's vacant, and then there's ones that we have in our parks. So it's really a great thing, and it kind of goes to our urban agriculture push that we started years ago. And now you even have people that are raising chickens in their backyard for eggs. So
Sure.
It's great.
Let's move on to one of the next priorities, and that is mental health and substance use disorders. Can you talk a little bit about is it surprising that people will admit to struggling with mental health challenges in a survey?
It really depends. So because it's self-reported, you never know whether or not people feel comfortable reporting that. But it is anonymous, so we hope that people are honest with that. But another key point of these surveys, or a key part to think about, is how it's worded in the survey. Have you been diagnosed? And some of these individuals may not have been to a provider to be diagnosed, and so there is always the question: is that a true representation? It's a shocking number. We definitely take that seriously, but we also just know what's going on in our community from the organizations we work with and the conversations they're hearing, and knowing where we do struggle and where people are having mental health concerns. That is it fully self-reported? We'll always have to wonder that, and hope that those conversations that we have in those focus groups and within our organizations really shed light on that, in addition to the data that we have.
What is the number?
So the number, roughly in the survey we have, was 21% was diagnosed with depression. So that's the only self-reported question that's asked, is depression. We also think about anxiety on top of that, is another really big issue that people struggle with in mental health.
And then with those numbers, with people suffering from mental health or depression, does that lead to alcohol abuse and drug abuse? Because as I'm looking at some of this information, that there's a lot of binge drinking and a lot of alcohol use. Does that correlate with mental health?
Absolutely. So alcohol use and drug use are commonly used as coping mechanisms for mental health disorders, and it kind of goes back and forth as well. So it's used as a coping mechanism, but can also spur those feelings of depression and anxiety when people are using substances as well. So it's definitely multifactorial.
And that's why it's been really important for us as policymakers and as leaders to talk about this, to reduce the stigma so people are not ashamed to come out, and also to be talking about and doing things, and we have, in terms of getting people access to care so that they will have, the counseling and medications and the things that they need, the healthy ways to deal with it versus having to resort to, using illicit narcotics or alcohol to essentially, dull the pain or those sorts of things. So our investment in the link, for example, has been something that's been really important. We've provided funding to help out the new Avera Behavioral Health 24-hour clinic, which I think is wonderful. There's an acute care clinic now that somebody can go to 24 hours a day, because if you're having a mental health crisis, you need help now. You can't wait until Monday. So we're doing a lot of different things, and we have a Project Hope Fund that we have through 211, so if somebody calls 211, or they go to the link and they have some gap in care, it could be transportation, they may need co-pays, there's money that can be awarded to help them out to make sure that they get the help that they need.
Sure. Okay. Well, at this point, we're going to take a break, but when we come back, we're going to talk about active and healthy living and how to get people off the couch and onto the bike trails. We'll be back in just a moment.
Hello, I'm Dr. Carson Rolfs from Falls Community Health, and I'm here to talk about childhood obesity. Today, about 1 in 3 kids and teens are overweight or obese. Children who are active and enjoy healthy eating habits have a better chance of staying fit as adults, and that means less weight-related health problems. So help your child early on by encouraging daily exercise and healthy eating. If you have any questions about childhood obesity, contact your physician or call Falls Community Health.
Welcome back to Inside Town Hall, where we are visiting with City Councilor Greg Neitzert, and his guest is Shelby Comus, the Public Health Prevention Coordinator. Let's continue our conversation and talk about the health of our citizens and how to get people actively moving. Who wants to talk first?
I can go ahead. So one of the things we noticed in our community health assessment was the lack of activity in our community here, and that comes in twofold. And one is people just being active in general outside of their work environment. And a quarter of our citizens here are not active other than the work that they do for a living. And then also 79% of those in our community do not meet the actual guidelines for physical activity. So we wanted to go about it 2 ways. It's just to get those people who are not moving outside of work to move in whatever that might be, and then also for those who are maybe getting in some activity to challenge them to meet the guidelines then. So those are some of the areas that we see in need of improvement in physical activity.
I don't know if we really want to hear it, but what are the guidelines? What are we supposed to be doing?
Yeah, so the current guidelines are 150 minutes of aerobic activity and then 2 days of muscle strengthening, or 2 days including muscle strengthening. Yep, that's a week.
I was going to say, don't say that's a day.
No, not in a day. So over the course of the week. So you might break that down into 3 days a week you're doing some sort of aerobic activity and 2 days of muscle strengthening. Or you might do 30 minutes of walking or running a day throughout 5 days of the week, and then adding in those muscle strengthening. So it can be in whatever kind of form of activity or the number of days that fits your schedule.
Sure. Now I know I've seen you out riding your bicycle before, so you've got me beats.
Yeah. Well, this is an important topic. I mean, we have an obesity epidemic here in this country, and an issue with metabolic disorders, things like diabetes and things like that, and things that are starting early and earlier with children because of that. And a lot of it really comes to our built environment. It's very difficult to be active many times when you have to drive a car, or you feel like you have to drive a car everywhere. So whatever we can do to make things more walkable and bikeable, so people could ride their bike to the bike trail, so they would feel safe having their children walk to school, and just getting activity throughout the day naturally versus feeling like, okay, I got to go to the gym and I was just working all day and I was sedentary. How can we get them to be just getting steps throughout the day, just as part of their natural form of life? I think that's really, really important, and that's not unique to Sioux Falls. That's unique to the entire country. And really, you look at other countries, they move a lot. In European countries, just as part of their day. They ride their bike to work, they're walking. But there's places like, for example, downtown, very walkable. How can we get that to the rest of the community, where we can just get people out and just enjoying life and doing things just as part of their daily life, not even thinking about it?
Well, if people walk to the grocery store, then, at first they're thinking, well, how am I going to carry my stuff back? But there's carts out there. There are all kinds of tools and things that people can use to at least try it. You know, if they're only getting a few items, maybe just walk down there.
Well, as an example, just by happenstance, I live very close to a grocery store. And so I actually have a basket on my bike, and because it's close and because I can get there, I just go every day, every other day, and I just get staples rather than one really large shopping trip. And so I can just ride my bike and go back. So how can we do things where we could encourage that with zoning and things where you could have what you had in the past, like a neighborhood grocery store, or even if you don't have neighborhood grocery stores, where we have roads where we work better and trying to make them more pedestrian friendly, where you'd feel safe crossing them. You know, we can do it. We've done it downtown. There's a lot of things that we can do to make it more friendly, where people would feel safe and it would feel like something they could do. It can be done.
Mm-hmm. Is there a program or any kind of help to like get people out and say, you know what, here's how you cross the street? It can be pretty daunting if you're going to try to cross the street at 49th and Louise, or at 26th and Marion, or where there's a lot of traffic, 41st and Minnesota Avenue. You know, how can we help people feel more comfortable walking through traffic?
Yeah, absolutely. And that's one thing that we try and do at the health department, and I know across our departments that are also in this space, is just educating both pedestrians and cyclists on safety, as well as those who are on the roads using their motor vehicles, and how to be safe when you're crossing the roads, and educating on how to properly cross a road. But also, how can we respect pedestrians and cyclists that are sharing the road with us, and what are those proper, are we staying 3 feet away from cyclists that are on the road, or 6 feet, wherever you might happen, and how can we share that news? Most people wouldn't know what the etiquette or even the law is around those using active transportation, and so how can we keep spreading that knowledge and educating individuals on that safety aspect?
In 2015, we adopted what was called the Complete Streets program, and that's a national movement, which makes us think about, as we build new roads, other forms of transportation. We have to think about pedestrians, and we have to think about cyclists, and trying to make sure that we're kind of trying to accommodate all of them. And one of the things that this plan talks about, and I think is really important, is looking at how can we enhance that program, giving it another look and seeing what could we do even more. That was a start, and so like to your point in terms of crossing streets, a lot of that also has to do with how in which we design intersections and how we do crosswalks. Can we do bump outs where it's a shorter area to cross? Can we do enhanced crosswalks, different signage? There's a lot of things that we can do to make it feel safer and to be safer crossing, because it can be very daunting crossing a 7-lane road. That just is not something that feels safe. So we need to think about those, because those create what they would call barriers. You may have a grocery store 3 blocks away, but if you have a very large road to cross, that's a barrier, and that makes it very difficult for people to get there.
Okay. What are some of the other strategies that are being done to get people maybe to the bike trails, maybe to the public swimming pools, either the indoor at Midco or the outdoor pools? Any incentives to get people moving?
Well, I mean, one thing that I know that the Parks Department has been looking at and working with other departments, and it's important to note that this is an every department, entire city issue. This is not just the health department. Everybody has to be involved. The Parks Department, Public Works. And one of the things that they're looking at is how can we designate maybe safe routes or designated routes to get you to the bike trail. My dream would that we would have, essentially in the city, wherever you're at, there would be a designated route where you would know that you can take bike lanes to get you to the bike trail. And we could sign it very well, and you could educate drivers that this is the route to the bike trail, and that it would be respected. And that goes to Shelby's point, which is educating people on what the laws are regarding bikes and sharing the road and what rights they have, and that they're a part of traffic just like anybody else.
Mm-hmm. Well, and I think a lot of people, they hook their bicycles to their vehicle and then they drive there. And you're saying you would like to see more people just leave their house and ride their bike there to the bike trails or to any of the parks.
Yeah, absolutely. And if you're able to do that, then you're going to use it for other things too. But people need to feel safe and comfortable being able to, for example, ride in traffic. We have to do it in such a way that you would feel safe. Now, there's going to be some roads where it's 40 miles an hour. It's going to be more appropriate to do what we're doing now, which is side paths. which are very, very wide sidewalks. There's some things where it's not going to be compatible, but on smaller neighborhood streets and smaller roads, it's easy where we can do it where we can share the road, and it would be wonderful.
Sure. Okay. Well, we also have oral health and then preventative care. Let's talk about oral health. What are we seeing in terms of people getting to the dentist?
Yeah, so we're seeing a couple of things, and one of is that we have a large number of children who are having dental decay at the young age, and we used to do a third grade survey that kind of measured this, and that's how we were able to gather that data. And then we're also seeing adults who just are unable to get to the dentist and therefore having issues with dental diseases, losing teeth early, pain in their mouths. Those are some of the things that we're seeing. But one challenge we also have is just knowing the impact of oral health diseases on our community, and that's something we want to pursue over the lifetime of this community health improvement plan, is understanding more of the oral health burden on our community, because there is a huge impact on the health of our entire being that starts in the mouth. And so we want to do understand a little bit more about that, and then also get people the care that they need and get them into the system.
Are there new programs or anything that will help people get to a dentist if they need to go or if they want to go?
Yeah, so there's a couple of different options for individuals who want to receive dental care, and that's first is you're always welcome at the Falls Community Health Clinic. We do accept individuals with all types of insurance as well as Medicaid at the clinic, and have emergency services. So if they don't have a regular provider, they can always reach out to Falls Community Health within the City Health Department to receive that care. But there's also programs throughout the city. Some private dental offices offer them, but as well as Delta Dental and doing their mobile services are a great way to get into the system. Some people just struggle just establishing care, and that's a great way to get in, get the education you need, get the services you need, and then work on establishing regular routine care.
And another wonderful program that we have as a city partners with the Sioux Falls School District. So we have dental care available at 3 different schools. So the kids can just go down, get their dental care, and go right back to class. So we're coming to them rather than them having to go to a dentist. And that's been done for many years, and I think it's a wonderful investment.
And that helps parents who are working and can't take time off, if they have shift work and they cannot take that time off to get their child to the dentist. They can go during school hours.
Absolutely.
Absolutely.
Okay. Well, let's talk about preventing all of these things that we've talked about that seem to be a little bit daunting.
Yeah, one of the things we talked about the impact on COVID-19 on the health of our community, and this is one impact that had a major we saw a major issue with that when COVID hit, is that routine care was being put on the back burner, and partially due to multiple reasons, because clinics were closing to routine care and focusing on emergency services necessary to keep people from gathering in those spaces, but also people were just kind of keeping to themselves, not going out and about nearly as much, and putting that routine care on the back burner themselves. And that's something we want to get people back in the habit of. Once we stop that routine care, we kind of have already established that, all right, well, I missed 1 year, and maybe it's not bad if I miss another year. And we get out of that habit of going. We aren't getting those reminders from our providers, and so this is an opportunity for us to really encourage individuals who maybe were regular in getting their appointments to get back in and get back on that schedule, but also encouraging individuals who maybe just haven't established a provider to establish one and make those connections. And we have a lot of wonderful health systems, and we want to encourage those individuals to find a provider that they feel comfortable with, so they can establish that routine care.
And if people feel like they can't afford it, there's Falls Community Health.
Absolutely. We always welcome individuals regardless of their insurance status or their income level. They're welcome at the clinic. We do not turn people away.
Okay. Well, it looks like that's our time for this episode of Inside Town Hall. Thank you both for joining us. And is there a website that they can, for more information about where they can get information about being healthier?
Yeah, absolutely. So they're always welcome on our city website, siouxfalls.org/health, and we have information on all of our city programs as well as our kind of our wellness-driven program, Live Well Sioux Falls. There's a link on there as well.
Okay, siouxfalls.org/health. We will see you next month. Thanks for watching.